Namaste, Jai Kali, Jai Mahadev, Jai Bharat. I hope everyone is doing good and taking good care of themselves. Remember, if you're fit and fine, you can take better care of your loved ones. So today I'm going to talk about various signs to look out for in a person and to analyze or to assess whether the person is having some kind of mental illness. And before I get into deeper into this topic of discussion, I would like to inform you all that we should create more awareness about mental health, because a lot of people are having mental illness and psychological issues and things related to past trauma, and a lot of things that happen that really influences and affects the way how we feel and behave. So we need to make or rather we should make more content or create awareness about mental health, because often mental health is considered a taboo. Anything related to psychology or psychiatry or mental wellness or illness is considered to be something which needs asylum, and it's looked down upon. So it's high time that we should create more awareness. Often people are undiagnosed, and a lot of people are having this psychiatric conditions, and they really face a lot of challenges. And it's quite challenging for the people around them as well if things are not diagnosed properly. So it's high time that we should talk about different kind of things that happens on a psychological level and create awareness about it, rather than making it a taboo and not talking about it. So if your mind is fit, the body is going to be fit, and definitely the people around you are going to feel good. So without any delay, let me get into the video, and it is all about mental illness signs that you should look out for. And the first sign is feeling sadness or depression for more than 2 weeks. So generally we often feel sad, but we start recovering, and we just don't remain sad for a longer period of time. But if sadness and depression is there for more than 2 weeks, that could possibly be a sign of mental illness, and definitely that person should seek help or medical assistance or therapy or counseling. So any feeling of sadness or depression, if it stays more than 2 weeks, it needs attention. Number 2 is extreme mood swings. We do have mood swings. Sometimes we feel good, sometimes we feel a little anxious, overwhelmed, sad, happy, excited. We do have mood swings, but frequent and extreme mood swings are an indicator that there is something wrong, and it's not good. So mild mood swings are fine. It happens on and off with everyone, with environmental change or chemical change in our brain or situation, circumstances. We do tend to go through mood swings, but mood swing on a frequent basis, and that to extreme mood swings, that's something serious. That is something that needs to be checked and diagnosed and looked into. The third point is worry and anxiety disorder. People who are constantly worrying about things which is not in their control is a sign of mental illness, because we need to understand we can take the responsibility of how we feel. We can't take the responsibility of the entire world, and we can't keep worrying about what others feel, how others think, what others do. We really can't control things that is beyond our reach, and that is beyond our boundaries. So unnecessarily worrying about things and having anxiety disorder definitely shows that there is some underlying mental illness that needs to be checked, diagnosed, and sorted out and treated with proper therapy. The next point is withdrawing from others. If someone is into a lot of these withdrawing kind of symptoms, that they just don't want to engage with any people on any conversation, or they just don't want to talk to anyone, they don't feel like talking to anyone, that is something alarming. I mean, like that person is going extreme inwards, and they are just withdrawing from even like speaking to others, and definitely that is another sign of mental illness. The other signs that we need to see is, delusions and hallucinations. So, very hallucinations, we know something which is not real, but our mind builds up an image and we tend to believe that that is real. So, hallucination and delusion could also be two of the most important signs of some underlying mental illness that needs to be diagnosed, checked, and treated. The next sign is, difficulty in normal life situation. Um, People with mental illness find the usual day-to-day tasks also very difficult, and mostly it is seen that they are unable to even work properly when they are in a job. So they are unable to perform well when they are in job. So that could also be one of the signs of an underlying mental illness, because normally we come across all kinds of situation, difficult situation, good situation, bad situation, but when it comes to working, we keep working, we face it, we face the challenges, we face the hardship, and then we keep on doing it, because we know that working is essential. But people with some like people rather with have people having underlying mental illness, they find the simple tasks or the simple difficult tasks also like a mammoth in front of them, and they can't handle that. And that is one of the important signs that the person is having some kind of mental illness. The other sign that one needs to look out for is either sleeping too much or sleeping too less. So we know, I mean, like an average, person should sleep around maybe from between 5-6 hours to 8-9 hours. I think that is absolutely normal. But anyone who sleeps more or anyone who sleeps really less is having some issue, and that calls for medical attention or medical supervision and diagnosis. And apart from that, the other point is, uh, when people get into too much of abusing drugs and alcohol, so these are also the sign of having some kind of either unchecked trauma or some kind of mental illness that they are suffering from, and that is the reason they get into it. And these kind of substance abuses further accelerates the process of the illness that is there, and they tend to lose control over their life, over themselves, and a lot of things get really messed up. So that is also one of the signs. I mean, like extreme into drugs and alcohol, that's not a good thing. So that is also one of the signs of a kind of mental illness. Apart from that, the next point is then, or rather the next sign is extreme anger outburst. So people having mental illness, they often have extreme anger outbursts, whereas in they often really get into physical fights, and they get really angry, furious, and they just cross all the limits. I mean, like getting physical and crossing limits when they are angry. And that's not normal. Angry is fine, getting a little verbal into a verbal argument, it's fine when you're angry, but getting into physical thing is a kind of sign, an important sign of mental illness. I mean, like if you don't like someone, you can just say that I don't like you, or I don't like what you're doing, or you can just shout. But getting into physical fights is a kind of illness, whether it is in between spouses, in between parents and children, or in between teachers and students. That's not good. That is the reason, in my previous video also I had explained that these corporal punishments are horrible. and they really affect the childhood, the growth of a child. And the same thing is with other relations as well. So extreme anger outbursts and getting physical is not good, and it shows that there is something much more than what we know, and that needs to be checked and medically evaluated and sorted out. And the last sign is having, suicidal thoughts throughout, predominantly throughout the day or throughout life. Having such thoughts, such tendencies are also a sign of maybe underlying trauma or a kind of, mental illness. So, when see, you need to understand that when trauma is unchecked, when the trauma happens, a person suffers from any kind of trauma, emotional abuse or trauma, that trauma further manifests inside our body, sometimes in the form of pain, sometimes in the form of mood disorder, or sometimes in the form of mental illness. So it manifests in a lot of ways. So the trauma needs to be checked, it needs to be talked about, and it needs to be addressed. And that is the only simple way to handle these kind of problems. So the more we talk, the more we understand, and the more we understand, the more we are able to sort out things. But if things are hidden, if people are in denial, and if such subjects are not talked about, definitely a lot of things goes unchecked. And if things are unchecked, we all suffer, and the others around us suffer. So we all need to talk about how we feel and what we feel, when we feel. And yes, this is the only way with which we can help ourselves and the others. So these were, a kind of 10 signs, that could possibly a mentally ill person would have. Any of these 10 signs. There are other signs also to look out for, but these 10 signs are the most predominant ones, and that is it. So yes, let's create awareness about mental health, and let's not make mental health a taboo, a subject that nobody talks about, because we need to start talking about how we feel, and only then others would also talk, and then others would understand, and that's how we will create more awareness. It'll be much more comfortable for people to be and feel the way how they are and the way how they feel. So yes, so this video was all about signs that a mentally ill person would have, or signs that you should not ignore if you are suspecting someone with mental illness. So yes, please do like, share, subscribe the video, and in case if you want to consult or want to discuss something, I'm a mail away. You can reach out to me at sarakhankalidasi@gmail.com. And yes, please do like, share, subscribe the channel, and share this video with your loved ones, and create awareness about mental health. Have a great day ahead. Bye.